So we're working with our local resilience forum, that's chaired by Rod Hanson, the Chief Constable of Gloucestershire Police. And we've worked historically as a forum for many years, since 2004, since they were formed, and that forum brings together the 7 councils in Gloucestershire, the police force, fire, the health system, and a whole range of other agencies, and we plan and prepare for emergencies. So as such, we're coming together in a group to understand what we need to do to plan together as agencies to respond to coronavirus. So the Strategic Coordinating Group has met 3 times, and we have a range of organisations around the table, including the 7 councils, the health system, the police and fire colleagues. So we are focusing on issues affecting the Gloucestershire system that can't be solved by individual organisations. So complex issues, for example, like community resilience and how we make best use of all the offers of help we've had from individuals and the voluntary and community sector, whilst ensuring that we don't miss vulnerable people, and trying to formulate some sort of coordinating function through the County Council. So for the last couple of weeks, the County Council has been working with schools and head teachers in Gloucestershire to understand what we could do to support key workers should schools have to close. So clearly we had the announcement yesterday that schools will close from the end of tomorrow, so Friday, and I think we're waiting for some further guidance from government to understand how we might need to adapt the plans we've already made. So we've been working with colleagues across Gloucestershire County Council to understand how we might continue to provide children who receive free school meals with their meal each day, and we're working through plans in light of the new guidance and the Prime Minister's announcement yesterday to understand how we might continue to do that and support these people within our system. So as a County Council, as with all other organisations, we have something called a business continuity plan. These are written for each team and each directorate in the County Council. Most of the time these are written for short-term emergencies, so maybe 7 days flooding, loss of power, that sort of thing. So we've reviewed them in light of this being a much longer-term incident that we're running. That work has been completed, so we have a list of what we call business critical functions, and these are primarily associated with protecting vulnerable children and adults, but also some core council services as well that we need to continue to provide. So if you think you may have symptoms, so a new persistent dry cough or a temperature, the advice is that you are to go home, and if you live on your own, you self-isolate for 7 days. If you live with family or friends, all the people in your household have to then isolate for 14 days from the first day of your symptoms. So the County Council is establishing a portal on its website, and that will be live from tomorrow, Friday the 20th of March. The idea being that if you're a member of the community or a voluntary community sector organisation or a business who has an offer to support vulnerable members in the community, you can complete the form and with your offer of help. You can also request help through this portal as well, and then that information will then be passed down to district councils, who will then be able to match the offers of help with the requests for help. The government has produced advice for mass gatherings on the .gov website. What I would say is that the situation is changing rapidly. It evolves each day. So if you are holding a meeting or event, then do look at the advice, but also think about who you're inviting to that event. So for example, if you have an event around pregnant women, focused on pregnant women, the advice is that they should be staying at home now, so you might want to think about a different way to reach those people. Similarly, if the main attendees at your event are they over 70s, you might want to rethink how you reach those people and how you cover what you wanted to cover at your event. Self-isolating for 14 days is an unusual situation. We don't often spend 14 days with our families and our housemates in a house confined to one space. So it's a slightly unusual situation, and I think it's worth, if you're not in that situation, doing a bit of thinking about how you will manage that. So for example, if you're well, the guidance suggests you can still go outside, so you could still exercise, you just have to keep away from others. So you could go for walks, you could play football in the park with your kids, as long as there's no one else about. You might want to think about what else you could do in the house, whether you example, to keep your children occupied, whether you've got board games or things like that to keep them happy, and how you'll manage for 14 days. A lot of the guidance suggests that a routine is quite helpful. Getting up and getting dressed rather than sort of staying in your pyjamas can be helpful in terms of managing your time and making a productive use of the 14 days. Some of the reports have been some people decorating their houses, getting on with jobs, all sorts of things that you can do. But I think we recognise that actually being in the house for 14 days can potentially have a slightly negative impact on your mental well-being, and to perhaps do some thinking about that now might help should you have to self-isolate. The other thing to consider when you're in the house for 14 days is how you might connect with your other friends and family, so how you might be ringing people. Perhaps you could still continue to ring your neighbours if they're old or vulnerable, but also FaceTiming, Skyping to keep in contact with friends and family can also really help. So one of the really important actions being undertaken by the Strategic Coordinating Group underneath the Local Resilience Forum is the provision of consistent messaging to the public. I think what's really crucial in an incident like this is we are giving out consistent messages from a range of different agencies working to support the public. So in our approach in the County Council has been to issue daily situation reports called SITREPs to our elected members. They're also being shared with district council members and parish and town councils. So the best place to go for up-to-date advice and guidance is the .gov website and also the coronavirus pages on the NHS website. I can completely understand the level of anxiety in our communities at the moment. I think people are clearly very concerned. We have the news changing every day. I think it's important to remember that the modelling that the government has issued suggests that 80% of us will get coronavirus, but the vast majority of us will get a very mild form of it. At worst, we might feel ill for 5 to 7 days with flu-like symptoms. Some of us may get it and be completely without symptoms. But the important thing to remember is that the measures announced by the government, the social distancing, the closing of the schools, the cocooning of over 70s, pregnant women and those with a long-term condition, are there to protect the most vulnerable. So I think there's something about how we all consider those and try and abide by them as much as possible to ensure we're protecting our most vulnerable.